Hi, so we've got it's across time zones, so I have no idea one end of my arse from the other on the time. But it's 9 o'clock England evening. I think it's 4 p.m. over in LA.
1 p.m.
1 p.m. over in LA even. Oh, it's 4 p.m. New York. That's harder, honestly. That's the beauty of tech, isn't it? The amazing co-founder and CEO of Safely app, which we'll get into the ins and outs, Lauren Weiniger, who joins us now to talk about all things sexual health and basically Safely, it's the world's first app tech platform that allows you to share your sexual health and tests, is that right, with partners and be very transparent and actually, just be a mature adult on that front. So just explain what Safely is, and then we'll come into all the nitty gritty afterwards.
Absolutely. So the Safely app, it lets you privately show your verified STD status on your phone. We're actually adding COVID status as well. And it makes it super easy and inexpensive to get tested and soon treated. So the kind of secret sauce, it's the only platform where it doesn't matter where you were last tested. You can get tested with us. You do not have to. So if you went to your gyno or doctor, clinic, what have you, we can import those records for free. So they're all verified. There's no faking it, if you will. And there's no excuse not to have it. Or you can get tested, so you can skip the doctor's visit, the waiting room, all that. There's a short little questionnaire. You can book appointments at 35,000 locations across the US currently, and we're adding at home as well. And you get your results in the app. And then you can share it really easy in a secure way with partners. It looks kind of like Snapchat in that way, but it shows, it doesn't ever show your personal information on the same screen. It's all within the app. It shows for 10 seconds, and then it disappears forever.
Amazing. Well, it's an amazing concept, and it's so simple. And that's I love businesses that are, you just go, that's just simple. You know what I mean? Loads of businesses out there, and a lot of the big unicorns and stuff. You go, it's just a really simple concept.
Yeah.
Where did it? Why did you launch it? Like, where have you come from in the world to get to where you are?
Yeah, so it's funny. Most of my career was not in the sex world, but this is an issue I've always really cared about. My cousin died of AIDS when I was young, which obviously hit hard. And in high school, when I actually hadn't even had sex yet, but I was in this peer education through theater company, and we were going to schools, from private schools to inner city schools, and doing these performances all around sex and sexual health and other coming of age kind of issues. And it was just mind blowing how, particularly in the areas that were with the highest risk and rates, there's just absolutely no sexual health education, complete misinformation. And so we were really able to help these kids that were my peers at the time really understand, things that can put them at risk for the rest of their lives, and just make healthier choices. But the company came out of Burning Man, actually. So I
love my company came out of being shit-faced for 3 days in Ibiza. So it's always crazy.
Yeah, I'd been in this really long-term relationship, and was newly single and newly, dating and having sex and all of that. And I wanted there to be a way to have an answer to that question: have you been tested? And a couple of friends that I was camping with, the girl, she will only have sex with you if you've been tested and can prove it. And she has her whole kind of protocol, really difficult to do, but really does it. So the guy was supposed to have gotten tested. He made an appointment at his doctor, but I couldn't make it in the end. Tried to get another one. Long story short, he didn't, and she was pissed. And I was thinking, why is it this hard, to get tested? Why is it often really expensive, particularly here? And why has there just never been an easy, trusted way to share your verified status? And the reason was, it was really difficult to build it. In order to do this, we had to partner up with many of the biggest healthcare companies in the world and do these large partnerships with data so that we can import that data. But the laws had just kind of changed. The technology had just kind of gotten to the place where it was almost possible, and we were able to do that. So yeah, we partnered up with Quest and LabCorp, now Mayo Clinic, and a bunch of others, so we can have that really seamless experience of, hey, I want to share my status with you. Great, you were tested somewhere else. Fine, here's my status. Cool. Move on to the next. Happy.
Like trump cards. Well, I've got it. I haven't got this. So I haven't got this either. So yeah.
Exactly. Like it's a tool to have the conversation. We say that mission is to end the spread and stigma of STDs in our lifetime, but this is just becoming the new normal of just like condoms at one point, nobody wore them, and then everybody wore them, and now many of them aren't again. It's a tool and just giving the user their information.
And then on the on being, what do you think, like having, because I'm assuming, and you would have done, when you came out and went, right, this is what I'm doing, this is the company I'm going to do, and then you look into all the STDs and the testing and the issues, what were like the biggest myths and like misconceptions when it came to getting tested, or the embarrassment, or what was the thing stopping people? What did you find when just before you launched and to launch?
Yeah, honestly, there were so many parts of it. What I realized is people have very different pain points. It's just so different. For gay men in particular, there's a lot of judgment. For women count as a pain point a lot more than straight men, that the judgment from the doctor, for instance, if you're going in to get tested and just having to be grilled about your lifestyle choices. The cost varies completely widely, and one other thing that surprised me and surprised a lot of people is that in general, when you go into the doctor and you say test me for everything, they're generally only testing you for a few things, and many not even HIV. And almost never are they testing for HSV2, which is most closely linked with genital herpes, although HSV1 can be as well. So with us, we just give you the option, and you take the little questionnaire. We recommend a panel, and includes all of them that you would be at risk for. And then if you want to get tested for HSV2, we allow you to add that on at no cost as well.
And do you think, just because it's kind of the whole getting tested it's always been a big male thing, isn't it? It's kind of, well, you're the one with the penis that's being, flung up there, therefore you're the one that needs to be tested. Is like, on that front, what would you say to women? Because there's a lot of women that go, well, we don't need to be tested. It's like, if the man says he's been tested, it's like, what are the big ones for women that to look out for and the signs, and actually, to go and get tested?
That is like a crazy thing to me, because honestly, women are the ones that bear the vast majority of the consequences for most of them. STDs are sexist, to be honest. But yeah, I mean, so they're saying like upwards of 65 or 70% of infertility could be linked to STDs, even treated ones, but particularly untreated. So, things like chlamydia, gonorrhea, where if you catch it early, it's an antibiotic, you should be fine. There are these strains of super gonorrhea, which are scary, but if women don't have symptoms in most of the cases, at least not for a long time, and then they develop really serious symptoms, and then it's too late, and it can be passed on to children as well. So it's something that it's so easy to do in a preventative way, and the fact is too that like people lie. Like if you Google fake STD test results, there are pages and pages and pages of these fake patient portals. They say for entertainment purposes only, really small. And it's like a LabCorp or a Quest like thing that looks real, and people are just inputting their information. So, people are already asking, and there's ways to fake it. And we want to be just no way. Like, this is one place, and as in many cases where you don't want people faking it.
No. It's never good to fake it, unless it's in business, and then you just fake it till you make it. That's kind of just the daily go-to when you're running a business. No, I'm still faking it. Someone's going to catch me out.
In general, I think we're all just faking it, but
yeah,
sometimes making it.
Yeah. When it comes to sexual stuff, no, that needs to be the real deal. And what on the So on how does the app work? Just talk us through, like, how does it work? Is there like a timer that kind of, when you're due to be tested, that will come up, reminders that just pops up, this voice that kind of suddenly announces. How does it work?
Yeah, so the reminders that we're like testing out different things now for reminders, because on the one hand we want people to be reminded of when to get tested again, and on the other hand some people won't want a reminder about that on their phone. So we're actually testing out different ways of doing that. But reminders are coming very soon. So the way it works is basically there are two flows. So flow number one is you were already tested. So you went to your, kind of or clinic, wherever. So you can just import your results. It's really easy. You just, it'll ask you, right now we're only US. We are going to be moving internationally soon. But so it's in the US. It asks you what state you were last tested in. That helps us narrow down the data set. Then it asks you can put in your doctor's information. We have a database of it all types ahead, or you can link it to your patient portal. Great. We are connected in with those electronic health record systems. So the data is automatically ported in. Bam, you've got it on your phone. Or you need to get tested, then the app takes you through a short questionnaire and asks you the same exact questions that your doctor would ask you, but without any of the judgment. How many partners, when's the last time you had sexual activity, are you having any symptoms, that kind of thing. Then it recommends the panel for you. So right now there's the standard panel, which is a 6-test panel. We also are just now launching the PAC for the adult film industry, and that's a more comprehensive panel. You can choose either, and you can pay out of pocket, in which case it's only $99 for the full panel, which is by far the cheapest option. That's for a standard panel. Or you can use insurance, in which case totally covered in most cases. If your insurance company won't cover it, we can kick it back to the cheaper option. So it's all about making it as easy, as accessible, as affordable as possible. And then, so right now it's just brings up a little map. You just select wherever you want to go. There's one within spitting distance, like anywhere. You get tested in and out in like under 10 minutes generally, and you get your results on the phone. And then we have our national physician network. So if you do test positive or something's out of range, our physicians follow up with you and coordinate ongoing care, calling prescriptions as necessary.
Now, and how does it work if, like, you have a test and a couple of the big ones, or something pops up? Like, how would it work on the app? Would it just suddenly on your profile on your app? Is it just screaming out something on there? And you're like, delete.
No, because we always want to be really sensitive about that. And we do get positive test cases a lot. And what's really interesting is that since the pandemic began, our positive test cases have gone up like 2 to 3 times. So people are still having sex, and
that though, you know what I mean? It's like that basic human interaction is something that no lockdown is going to stop an animal.
No lockdown is going to stop it, but people don't want to go into the doctor's office now, and a lot of the free clinics have actually closed because of COVID. So I think once we get through this, I'm worried, to be honest, that we have a really large, even more like even higher rates of STDs than we did before this all started, which they'd already reached an all-time high. Wait, so what was? I'm sorry, I'm so tired today. The question was. I started answering it different.
How does it work when it shows up on that you've had the test?
Oh, right. Yeah. So when people test positive, so our physicians will call you and deliver those results. So if it's gonorrhea or syphilis or chlamydia, they'll just call in a prescription for you. And you give them your pharmacy information and go pick it up. And we're building things in the app to make all of this even more seamless, and delivery of medications as well. And then for HIV, we coordinate ongoing care we have a number of partner groups that with support groups and ongoing care for that. Oh no, did this just go away? Oh,
you're still there. I can see you and hear you.
So weird. It went away for a second. But yeah, so we have a really incredible both the network of physicians and our clinical operations team. So we take every positive case very seriously, but try to make each of these things as kind of seamless as possible. And then when you get a positive result, after that, then the results will get pushed to the app. You could always delete it, but those do get pushed through, but only after you've had a conversation with a human.
What would you say when you look at, because obviously you're kind of seeing STDs flying in front of your face the whole time and all the data, and what would you say, having since launching or since starting the research and coming out, what are the big ones? Like what are the ones that are not worrying, because they're all kind of they're worrying, but kind of the trends. Have you seen any? What are the big ones to look out for? Because there's some that don't really show any symptoms. So yeah, what would be your advice to people to look out for, and what to do?
So there's a few parts there. So the as far as trends go, I mean, honestly, all of them are rising pretty steadily. Gonorrhea is the one that's the most worrisome, because there are antibiotic resistant strains of gonorrhea. So if you do get it, then if you can't be treated, that can become serious. Chlamydia is the highest, and continues to go up, although we are seeing real increases across the board. It varies too by demographic and even region. So some demos are higher in one versus the other. For women, where that's for our users, where we're seeing the highest numbers right now, is on chlamydia and HSV2.
And on the app, sorry, go for it.
I guess the last thing I would say on that, though, is like, when it comes to things to look out for, the thing is, and I kind of mentioned this earlier, there's not much, particularly for women, to look out for. Like, there's really no symptoms early time in many cases, if not the majority. So the only way to know is to get tested. And then again, if you get tested, it's really, most all STDs are treatable and most are curable. And, HIV is not even remotely a death sentence. You can positive but undetectable. That's how effective the drugs are. There's incredibly effective antivirals for HSV2 and 1. So all of these things are things that are manageable, absolutely, but it's not knowing, passing it on to others, or not knowing and then having these really terrible effects that happen over time.
Do you think when it comes to like women, there's still a massive stigma and taboo about sexual activity, especially if you're single and you're being loose, single girls and sleeping around. Do you think that stops? It's sort of that kind of, well, we're gonna have sex with people, and if we use a condom, and or if we're on the pill, and that's it. We don't have to worry about anything. Have you seen, like, when you see the people getting tested and stuff, have you seen that kind of sort of the kind of denial and just keeping quiet and a bit too embarrassed to have a test or ask, or is that one thing you're doing with the app?
Yeah, I mean, one big thing that we are doing is, yes, in like the messaging, and one reason why people love it is it's about empowering people, but in particular women, to take control of your sexual health, to demand transparency from your partner. But yeah, it's interesting. Our users it's like 60% women on overall users. So they're making other people share their status with them. They're sharing status with them. The that are getting tested the most are men. So men are getting tested a lot more frequently than women, but women are using the app to show and to ensure that their partners have been tested and making them share it with them, which kind of makes sense. It also kind of varies based on like age group. So we find that like the younger women are really excited. And the younger men are sometimes more like, they don't know how to talk about sex and STDs yet. So that's why a lot of it really does come from the women sort of being that education, demanding that transparency from their partner, making it so, hey, okay, you want to have sex? Fantastic. I'll show you mine if you show me yours, kind of thing. And then, if he's like, I've been tested, and she's like, okay, great, prove it. And you can't, well, I mean, he's going to become a member for life and tell all of his friends.
And if you this year, I mean, because this year's been a funny year, and everyone's been locked in. And as far as I'm concerned, or what we've seen, there's been a hell of a lot of sex going on and hooking up. And what's your what's your advice, and what have you seen to that whole dating during COVID, basically, and dating safely? What would be, what have you seen, and what's sort of your advice on how to do it?
It's such a murky area, and we're constantly navigating it too. To tell people, particularly people that live alone, but even for anyone, just completely don't date anybody for an entire year. It's hard. I mean, mental health and human connection matters too. What we've seen people do is, the dating apps, actually, most of them have increased in their traffic. A lot of them have added videos and whatnot, but then eventually you want to meet the person. And so if both people get tested, get COVID tested before, as well as STD tested beforehand, if they're both been quarantining before and they see each other and then quarantine after, you can, your quarantine pod can shift over time. You just have to do it safely. I know for me personally, like towards the beginning of quarantine, there were, 6 people that I saw, and I knew that one of each of them had one other person they saw, and that was it. And we weren't allowed to see other people, and that's kind of how we kept it safe and could do that. And then I ended up seeing somebody else, so I would just quarantine for like 2 weeks after that, and I wouldn't see the others. And I think that's the same kind of thing. You can have, if you choose to have a sex buddy, that's one of my favorite things I've seen, actually.
Like, were they six sex buddies or 6 friends?
Exactly. It's, you can have a sex buddy, you can have multiple sex buddies if you're in a pod together. What's not okay is if if you're seeing people that have not been tested, who haven't been tested recently, and they're not being safe about it, and then continuing to do that. That's how it continues to spread. But people do have to everyone has a different comfortability level with it. There's also people that have had it. If it's within 2 months, then they're a lot more likely to have active antibodies and not be able to get it and pass it on. So it's just complicated. I try, I feel like in general with the company, I say, like, I'm not in the business of judging people, and I'm not in the business of telling people what to do. What I try to do is give people just enough information, or give them so that they can make better decisions for them. As human beings, we're really bad at making decisions when we have way too much information. And we're also really bad at making decisions when we have no information. And with sex and STDs, the longest time it's been no information. So I'm trying to just say here, like, these are parameters. This is what this person last tested. This is what they were tested for. If you just got, just met on Tinder or FetLife or Killing Kittens, and then you should probably use a condom. But it's still a hell of a lot better than nothing if you don't, if they were tested a few days ago versus never having been tested at all.
Yeah, we always get that. Well, what's your policy on safe sex at the parties? And I'm like, well, they're consenting adults. We put bowls of condoms around, but that's as far as we can go. You know what I mean? Right. We can't go around with a flashlight and go, put it on, and go into every room and throw people off beds. That's the thing, isn't it? At the end of the day, everyone's sort of intelligent adults. You give them the information, and then it's up to them to do it or don't do it.
Information, and then I like to call it positive peer pressure. So make things easy enough to do, and also make it like the cool thing to do, if you will. Like, so with wearing masks is a good example, at least in where I live in LA. It's not like many parts of the country, but it's uncool to walk around in a place that are people at a grocery store and not wear a mask. It's also illegal and enforced now, but we want to, as a society, like, protect one another. So let's take actions that are good for ourselves and good for others, but we're not all exactly the same, and people do have different risk tolerances. And that's not for me to decide for everybody. It's just for me to say, here is information, here's a tool that you can, live your life in the way that makes the most sense for you.
Yeah. And what's the thing that drives you? Like, what doing it and launching it? Where's the passion Where does the passion come from? Like, what's the thing that just drives you all day, every day? Oh, this is your purpose. And this is what you're meant to be doing. And yeah.
It's our users, and like what's great is, I created a product that I wanted to have, that I wanted to exist, and I was not always in sex remotely at all, right? And even when I was really like thinking about it and decided, okay, I just raise the first money, I'm gonna jump in full time. I remember my dad was like, kiddo, it's a really good idea, but are you sure you want your brand to be sex and STDs? And I was like, actually, no, I'm not sure about that. Like, I was in like finance and biotech. That wasn't stigmatized at all. Some of a little bit, but it's like, I think that's why I have to do it. And what really like, if I'm ever like having like a down day or just exhausted, like, seeing like our users, like they'll DM us stories, they'll, leave reviews and all of that. And really helping people, and particularly women, feel more comfortable with the fact that they have sex. They are human beings. They like pleasure. That it doesn't need to come with judgment, and they can do it in a way that then it also can give them some peace of mind, and they don't have to have that kind of head fuck about it. And I think that it just really helps a lot of people. But the ones that resonate most with me are the ones that I am and or was, and that's women who are figuring out who they are, and sex is a big part of that. And being able to do that in a way that doesn't feel like you have to conflict with weird values. It doesn't. You can be a great professional person and have great sex, and you can be also.
That's the thing. It drives us, isn't it? It's the core of every human being. So
the source of life.
Yeah, exactly. It shouldn't be dirty, and so why can't we talk about it? And my dad threw a computer across the room when Mum told him what I was launching. So yeah,
I can imagine.
Oh yeah, so that did not go down well. I think that's partly what fueled me. I was just pissing off my dad. It's kind of, I think I've done that since I was little. Let's try and get a reaction out of Dad. Oh look, it's working. We'll keep going. We'll keep poking the bear. But on your
have you since kind of going into this, it's been sort of like, for my personal journey, it's been really interesting too, because I wasn't this comfortable talking about sex when I first started it. And I don't know if you guys fundraise, but like fundraising with this was very bizarre. It's mostly like older male and white man investors, and you get on a stage and you say the word sex, and like half the audience like blushes and feels funny. But then you talk about like, this is a great opportunity, and these are all the people that really want it, and they start to really understand. And now I like relish those moments, because as I find that as I've become extremely comfortable, it helps them become comfortable. And why should we be uncomfortable talking about this?
We all if you talk about it as if it's not, like my friend's like, oh, there she goes again, she's talking about sex. I'm like, it comes out. I'm like, yeah, too soon.
Yeah, my level of like what is appropriate to talk about at a party has definitely shifted, and like, people always ends up with like a little. Not that I go to parties anymore because COVID so much, but
sweet parties.
Circle around, walk by like, oh, I heard an STD. Is Lauren here? I'm like, yeah, that's me. And I'm really happy to answer them.
Yeah, one of my friends, I'm known as Orgy Girl in her office, apparently.
I love it.
You seeing your orgy friend? I'm like, perfect. So yeah, or you're that Emma. Always got you're that Emma.
Orgy Girl sounds more fun. I like that.
Yeah, exactly. But you know, the more you talk about the sex, the more I find everyone around you wants to talk about it, and they suddenly totally open up, and you get that, oh my God, I've only just met you, and I'm telling you everything about my relationship, and it's kind of a bit of a that kind of bit of a psychologist role. And that's what you realize why it's so important, because people want to talk about it. They just don't feel they're allowed to talk about it.
100%. I couldn't agree more. I think you probably have very similar experiences with that. But like any party or whatnot, there's at least one, but usually multiple people, and because it comes up in the just small talk of, oh, and what do you do? And I say what I do, and it involves sex, and same with you. the entire conversation, that people cannot wait to talk about it, as to your point, share very like personal, intimate details about their sex life with me, to their sexual health and, you know, STD history. And I love that part of it. We're both kind of giving people these avenues to have the conversations and do the things that they want to do anyway.
And what would you on a business level? Because obviously, yeah, as you said, fundraising, raising money to a bank of stale pale mail, as I call it, investors, and you go sex, and it's like, oh, it's a little girl talking about sex. Or I've often had, oh, I need to run it past my wife. I'm like, oh, why? Because you run all your other investments past your wife. But then actually thinking about it on, you know, what you do and the STD kind of side of things is actually quite male. So actually you've got a spin that you're instantly telling the man, it's all right, you can shag around, just have the app, download it, have a test, and you can carry on being stallion. So there's quite a male spin on your business that you can kind of twist a bit.
Yeah, it's funny that there definitely is. I'd say like we have really evangelical users, but they really span the gamut. Sometimes it's women, sometimes it's men, sometimes it's gay men. Lesbians love us, but don't use it for testing as much just because they're lower risk. But yeah, most of my investors are men, and I think you're right, particularly when you, on the older side, the men do tend to get it a lot. Divorced men love us, in particular. They're like back on the market and didn't know what to do, and are really scared about what's out there.
Let me in.
Exactly. Like back on the market, but now I need to, what do I do now? Does it still work? Yeah, no, it's been bizarre. I like it though, because it's very binary. People really get it and they're so excited. It just makes sense, or they don't. Cool. Like I'd much rather get to it and they don't quick, as opposed to a bunch of men.
That's it. It's like a yes or no, and like we say with ours, we're like Marmite. You know what I mean? It's like love or hate. Either end. There's no middle ground. It kind of provokes a very emotional reaction. It's either we love it or you're fucking disgusting. It's either, you know what I mean? There's no middle.
Yeah, I think that's like the best thing though, because we don't waste time on the not. And you know, for us, like I don't have to convince everybody in the sexual relationship. I just have to convince one person, or have one person that has always wanted this to exist, say to the others that they need to do it too. And so that's kind of how that virality part works. And there's a lot of people that have always wanted this to exist, and they can set the stage. And the others, if people don't, then fine, but they're not going to have sex with that person. So it's a pretty strong driver.
Cool. But you know what, I'm gonna just before we end, just quickly, how would you use the app? Like someone downloading it, what's your advice on how to use it?
Yeah, it's really easy. You download the app, it's totally free. And again, if you've already been tested, just import your results so you have your status on your phone. Then you can go ahead and start sharing them with partners. So it just texts them again. Then it prompts them to download the app, so your medical information never leaves it. It's all super secure, and your information is there for just 10 seconds. Or you can get tested, super easy. Just skip to the doctor, make an appointment, get tested, stay up to date. It shows really, really clearly, the date you were last tested, what the results were, so that you have the information and you can share it. We also just launched the first dating app badge, actually the Safely badge on a dating app. So HUD is hookup dating, and now you can actually integrate your Safely badge right in your profile there.
Nice. Well, do you know what? When you do hit the UK, then we'll have to, because we're adding badges to all our profiles of people that do the workshops, like they do a BDSM workshop or a tantric massage workshop. They get badges on their profiles. So so when you hit the UK, we'll have to add the safety badge.
100%. We'll be there hopefully by next year, or by sort of mid next year. So I will definitely keep you posted. I think that would be really awesome.
Cool. Well, do you know, we've got loads of US members, so maybe we can put it on the US side. Cool.
That's
Do you
all
want to say what?
With the others too, like they're all international, so they just kind of ring fence on the US ones.
Cool.
But yeah,
that'll be wicked. Wicked. Well, thank you so much for chatting all things sexual health. And that was brilliant. So thank you.
Thank you so much.